Good day everyone, I am Maranel Manzanilla from Bachelor of Science in Psychology 3C, and I will discuss some psychological disorders. Conduct disorder is a serious behavioral and emotional disorder that can occur in children and teens. A child with this disorder may display a pattern of disruptive and violent behavior and have problem following rules. The symptoms are aggressive behavior, destructive behavior, deceitful behavior, and violation of the rules. Ang psychotherapy ay tinutulungan ng isang bata kung paano i-express o kokontrolin ang kanyang anger in appropriate way. At tinutulungan siya in solving skills, anger management, moral reasoning skills, and impulse control. Second one is family therapy, kung saan tinutulungan ng bata to have a family interaction and communication among the family members, and tinutulungan din ng parents ng positive outlook to their children's behavior in home. Schizophrenia is a serious mental disorder in which people interpret reality and abnormality. It may result in some combination of hallucination, delusion, and extremely disordered thinking and behavior that impairs daily functioning and can be disabling. In men, symptoms typically start in the early of mid-20s, and in women, symptoms typically begin in the late of 20s. It's uncommon for children to be diagnosed with schizophrenia and rare for those older than age 45. Symptoms, delusion. These are false beliefs that are not based in reality. Ito yung mga bagay na akala niya may nananakit sa kanya, may nakaharas sa kanya. The next one is hallucination. This is usually involved seeing or hearing the things that not exist. So, ito yung may mga bagay na nakikita niya, naririnig niya na nasa imagination niya lamang. Disorganized thinking and speech. Ito yung mga bagay na kapag tinanong mo siya, hindi related yung sagot niya sa mga tanong mo. The next one is extremely disorganized or abnormal motor behavior. Ito yung makikitaan mo siya ng pagiging childish, silliness. First therapy is individual psychotherapy. During the session, a therapist or psychiatrist can teach the person how to deal with their thoughts and behavior. They learn more about their illness and its effect, as well as how to tell the difference between the reality and what's not. It can help also them to manage everyday life. Second one is cognitive behavior therapy. This can help the person change their thinking and behavior. A therapist will show them ways to deal with voice and hallucination with a combination of CBT session and medication. They can eventually tell what's trigger or psychotic episode and how to reduce or stop them. Cognitive enhancement therapy. This type of therapy is also called cognitive remediation. It teaches people how to better recognize social cues or trigger and improve their attention, memory, and ability to organize their thoughts. It combines computer-based brain training and group session. Post-traumatic stress disorder is a mental health condition that triggered by a terrifying event, either experiencing or witnessing it. Symptoms may include flashback, nightmares, and severe anxiety, as well as uncontrollable thoughts about the event. Itong post-traumatic disorder, mga nakakaranas nito ay karaniwang nakakasaksi ng bawa ng pagpatay o kaya yung mga andun siya mismo doon sa aksidente na kung saan yung kasama niya namatay. Karaniwan ganun yung mga nakaka-experience ng ganitong disorder. May 4 siyang klase ng sintomas. First is intrusive memories. Mga nakapaloob dito ay recurrent, unwanted distressing memories of a traumatic event, reliving the traumatic event as if were happening again, flashback, upsetting dreams or nightmare about the traumatic event, severe emotional distress or physical reaction to some that reminds you if the traumatic event. Second is avoidance, trying to avoid thinking or talking about the traumatic event, avoiding place, activities, or people that remind you of the traumatic event. Next is negative changes in thinking and mood. Hopeless about the future, memory problem, including not remembering important aspect of the traumatic event, difficulty maintaining close relationship, feeling detached from family and friends, lack of interest in activity you once enjoy, difficulty in experiences positive emotion, and feeling emotionally numb. Last is changing in physical and emotional reaction, being easily startled or frightened, always being on guard of danger, self-destructive behavior such as drinking too much or driving too fast, trouble sleeping, trouble concentrating, irritability, anger, and aggressive behavior, overwhelming guilt or shame. Treatment, psychotherapy. Ang nakapalab dito ang cognitive therapy. This type of talk therapy help you recognize the way of thinking they are keeping you stuck. For example, negative beliefs about yourself and the risk of traumatic things happening again. And second is exposure therapy. The behavior therapy helps you safely face both situations and memories that you find frightening so that you can learn to cope with them effectively. Exposure therapy can be particularly helpful for flashback and nightmares. One approach uses virtual reality that allows you to re-enter the setting on which you experience trauma. Last is eye movement and desensitization and reprocessing. EMDR combines exposure therapy with a series of guided eye movements that help you process traumatic memories and change how you react to them. And in medication, we have antidepressant. This medication can help symptoms of depression and anxiety. Second one is anti-anxiety medication. This drug can relieve severe anxiety and related problems. Next is prazosin. While severe study indicated that prazosin may reduce or suppress nightmare in some people with PTSD. Bipolar disorder, also known as a manic depression, is a mental illness that brings severe high and low moods and changes in sleep, energy, thinking, and behavior. People who have bipolar disorder can have periods in which they feel over-happy and energized and other periods of feeling very sad, hopeless, and sluggish. In between this period, they usually feel normal. You can think of the high and the lows as two folds of mood, which is why they called bipolar disorder. Symptoms are sadness, loss of energy, feeling of hopelessness and worthlessness, not enjoying things that once liked, trouble concentrating, forgetfulness, talking slowly, and less of a sex drive. Inability to feel pleasure, uncontrollable crying, trouble making decisions, irritability, needing more sleep, insomnia, appetite change that make you lose or gain weight, thoughts of death or suicide, attempting suicide. Medication in mood stabilizers such as Tegretol, Lamictal, and Ribacotep, and in antipsychotic drugs is Bragilar, Latuda, and Cyprixa, and Seroquel. Treatment, psychotherapy or talk therapy, it is recommended too. There are several different types. Options can include interpersonal and social rhythm therapy. This is based on the idea that having daily routine for everything from sleeping, eating can help keep your mood stable. Next one is cognitive behavior therapy. This helps you replace and habit and action with more positive alternatives. It can also help you learn to manage stress and other negative triggers. Next is psychoeducation. Learning more and teaching family members about bipolar disorder can help give you support when episodes happen. And next is family focused therapy. This set up as a support system to help with the treatment and help your loved ones recognize the beginning of an episode. Attention Deficit Hyperactive Disorder or ADHD is a condition that affects people's behavior. People with ADHD can seem restless, may have trouble concentrating, and may act on impulse. Symptoms of ADHD tend to be noticed at an early age and they become more noticeable when a child's circumstances change, such as when start school. Most cases are diagnosed when children are 3 to 7 years old, but sometimes it's diagnosed later in childhood. Hyperactivity and impulsive, being unable to sit still, especially in calm or quiet surrounding, being unable to concentrate on tasks, excessive physical movement, excessive talking, being unable to wait their turn, acting without thinking, interrupting conversation. Treatment in medication is methylphenidate, desamphetamine, and atomoxetine, and guanfacine. Treatment and therapy is psychoeducation, means you or your child will be encouraged to discuss ADHD and its effect. It can help children, teenagers, and adults make sense of being diagnosed with ADHD and can help you to cope and live with the condition. And behavioral therapy provides support for careers of children with ADHD and may involve teacher as well as parents. Behavior therapy usually involves behavior management, which uses a system of rewards to encourage your child to try and control the ADHD. Parent training and educational programs. If your child has ADHD, especially tailored parent training and education programs can help you learn a specific way of talking to your child and playing and working with them to improve their attention and behavior. Second one is social skills training. It is involve your child taking parts in role play situation and aim to teach them how to behave in social situations by learning how their behavior affect others. Last is cognitive behavior therapy. This is talking therapy that can help you manage your problem by changing the way you think and behave. A therapist will try to change you or your child feels about the situation, which will in turn potential changes their behavior. Depression. Depression is a mood disorder that causes a persistent feeling or sadness and loss of interest, also called major depressive disorder or clinical depression. It affects how you feel, think, and behave, and can lead to a variety of emotional and physical problems. You may have trouble doing normal day-to-day activities, and sometimes you may feel as if life isn't worth living. Symptoms are feeling of sadness, tearfulness, emptiness or hopelessness, angry, irritability or frustration, even over small matters, loss of interest or pleasure in most of all normal activities such as sex, hobbies, or sports, sleep disturbance including insomnia or sleeping too much, tiredness and lack of energy, so even small tasks take extra effort, reduce appetite and weight loss or increase craving for food and weight gain, anxiety, slow thinking, speaking or body movements, feeling of worthlessness or guilt, fixating on past failure or self-blame. Treatment, self-help, regular exercise, getting enough sleep, and spending time with people you care about can improve depression symptoms. Counseling or psychotherapy is talking with a mental health professional. Your counselor helps you address your problem and develop coping skills. Sometimes brief therapy is all you need. Other people continue therapy longer. Alternative medicine, people with mild depression or ongoing symptoms can improve their well-being with complementary therapy. Therapy may include massage, acupuncture, hypnosis, and biofeedback. Autism spectrum disorder is a neurological and developmental disorder that affects how people interact with others, communicate, learn and behave. Although autism can be called diagnosed at any age, it is described as a developmental disorder because symptoms generally appear in the first 2 years of life. Symptoms include a problem in social communication and interaction, restricted or repetitive behavior. Ito yung mga paulit-ulit na paggalaw. Example, ang paulit-ulit na pag-headbang, paulit-ulit na pag-ikot, and next is they have different ways of learning, moving, or paying attention. Like for example, kapag kinakausap sila, mas gusto nilang tumingin sa labi ng kinakausap nila kaysa sa mata. Therapy in autism are behavioral management therapy, cognitive behavioral therapy, early intervention, educational and school-based therapies, joint attention therapy, medication treatment, nutritional therapy, occupational therapy, parent-mediated therapy, and physical therapy. And in social skills therapy are speech-language therapy.